Welcome to the program. I'm your host, Neil Howard, here on Health Professional Radio. Thank you so much for joining us for another segment. In this segment, we're going to be speaking with Dr. MeiLan Han. She's joining us here as the author of the book, Breathing Lessons, A Doctor's Guide to Lung Health. She's also going to talk about the importance of correctly identifying COPD risks, the symptoms, exacerbations, and how doctors and patients can have productive conversations about these topics. Welcome to Health Professional Radio, Dr. Han.
Thank you so much, Neil.
Thanks for joining this morning. Would you please give our listeners a look into your professional background and talk about where it is that you're practicing now, your current role?
Yeah, sure. So I am a lung physician, pulmonologist at the University of Michigan. I've worked here for roughly 20 years. Mm-hmm. I'm also on the GOLD Committee, which is an international group that writes guidelines for COPD. And I take care of quite a few patients with COPD, so it's hopefully relevant to today's discussion.
When was COPD, to your knowledge, first identified, and what exactly is COPD?
So our understanding of COPD has really evolved, I would say, over the last 50 years, dating way back to when we were looking at cadavers and anatomy. Physicians noted that for some patients, the airways were inflamed, they were full of mucus, and then for other patients, the alveoli were destroyed. And these were sort of the classic beginnings of our modern understanding of COPD, where both chronic bronchitis, the airway component, as well as the alveolar destruction or emphysema component were first identified. So COPD, or chronic obstructive pulmonary disease as we currently recognize it, is a chronic progressive lung disease. It's usually associated with chronic exposure to some kind of noxious stimuli, most commonly tobacco smoke, but there's still a reasonable number of individuals with COPD who have not smoked. But it makes it really difficult for patients to breathe. It currently ranks as a leading cause of death in the United States, and is estimated to affect at least 16 million people in the United States.
Are there many causes of COPD, or simply, as you said, some noxious material being chronically introduced into the lungs?
So I think there are likely many causes. We recognize tobacco smoke exposure is probably the biggest risk factor, but there are certainly other environmental and occupational factors, probably even things going on in childhood, believe it or not, including respiratory infections, et cetera, that likely contribute to the risk of developing COPD.
So how do you recognize it? What are some of the symptoms? And are these symptoms severe enough to warrant you to go to the hospital and for a physician to check specifically for COPD?
It's a really great question, Neil, because one of the biggest problems we have with COPD is that it's underdiagnosed. So initially, patients either may have few symptoms or tend to sweep them under the rug. So one of the goals of today's discussion is really to help healthcare providers figure out how to engage with patients to get those symptoms and important historical factors out of them so that they know when to do appropriate diagnostic testing. So unfortunately, fortunately or unfortunately, the lung actually has quite a bit of reserve. So it may take some time before enough abnormality develops that patients will actually talk to their physicians about it. So one of the things that we want to do or are trying to do today is to raise awareness about diagnosis. So you want to ask about things including tobacco smoke, but not only tobacco smoke exposure. You want to ask about activity levels. Sometimes asking about symptoms isn't enough. We have to ask about whether people are keeping up with others of the same age or whether people are slowing down compared to perhaps what they used to do. Also things like cough and shortness of breath. But as you pointed out, one of the most concerning features about COPD is that individuals can experience periodic flare-ups. So for some people, it may simply be that they're having frequent episodes of what someone perhaps is terming acute bronchitis. But those may actually be flare-ups of COPD and hint at a much more concerning issue. So one of the messages we're trying to get out today is to help both physicians and patients really be aware of the importance of these periodic flare-ups, or what we call exacerbations, which is where patients have more symptoms and they usually have more cough, more shortness of breath. They usually need to be treated with either antibiotics or steroids, but sometimes they can be so severe that patients end up in the hospital. And these are the kinds of events we're trying to prevent.
As far as COPD is concerned, once diagnosed and a person, these toxins are no longer introduced, is COPD reversible?
Another really great question. So as far as I know, the lung damage itself, at least to the air sacs, emphysema, is not reversible. I think sometimes some of the inflammation in the airways, if it's early enough, probably is reversible. We know that some of the symptoms, such as the chronic bronchitis, the mucus production, and cough, can get better when patients, for instance, stop smoking. But unfortunately, Neil, the fact of the matter for all of us is that we actually all lose lung function over time. And unfortunately, for many patients with COPD, even after they stop smoking, they may lose lung function at a greater rate. And so that's why it's really important that we as healthcare professionals help to identify patients and get them on appropriate treatments. One of the scariest things about exacerbations or these periodic flare-ups is that they actually are associated with more rapid lung function decline. So it's really important that we be aware of patients that are having frequent exacerbations and do what we can to prevent them.
What's the current treatment landscape as for COPD?
So most of our treatments, the majority of treatments, are various types of inhalers. Those may include long-acting bronchodilators. We actually have two types. And then there are inhaled steroids, which may be particularly helpful for patients who are having frequent exacerbations. In the last few years, we now have new combinations of therapies available where you can actually get all of these long-acting medications in one single device, which has been a really great advance. But they're working on new treatments all the time, and I'm really hopeful that in the next few years we'll have even more exciting new treatments to discuss.
Earlier in our conversation, you mentioned childhood activities being a risk factor later in life. Could you talk a bit about that?
Right. So we don't fully understand all of the risk factors, but the current thinking is that, for instance, things like frequent respiratory infections can play a role. So you want to make sure your children are vaccinated for all of the usual suspects, get all of the recommended vaccinations for children, and now that does include COVID-19. Other things like chronic exposure to secondhand tobacco smoke, starting smoking too early, vaping. These are other really important conversations we need to have with our children, as well as paying attention to things like both indoor and outdoor air pollution. Interestingly, even factors such as having playgrounds in schools near high traffic areas can actually predispose children to lung problems. So we really have to pay attention to the environment and be mindful to try to protect the lungs of our children.
With the regulations on marijuana being dropped state by state more frequently, is there any difference between marijuana smoke, vaping, cigar smoke, or cigarettes when it comes to COPD?
Oh, my goodness. We could be here all day. So certainly there's good evidence that conventional cigarettes lead to COPD. For vaping, we still don't have a lot of long-term data, but the data we do have suggests that the compounds themselves are quite toxic and that they can increase the risk for lung disease. In children, perhaps the most concerning thing is E-Valley, which is this vaping-associated lung injury. And then, for marijuana, the effects are really complicated because a lot of people who smoke marijuana also smoke conventional cigarettes. So the bottom line that I tell most people is, just don't smoke anything don't breathe anything that's not clean air. Otherwise, it's really a risk.
Where can we go and learn more about COPD and get a copy of your book, Breathing Lessons, A Doctor's Guide to Lung Health?
Well, to find out more information about COPD, I'd love for people to visit the website, listentoyourlungs.com. It's got a lot of really great information to help you understand how patients and healthcare professionals can have conversations, talk about flare-up management, and developing action plans. As for the book, it's actually available at retailers everywhere, or you can actually look at my website, drmeilanhan.com. But thank you for asking.
Great. Dr. Han, I appreciate you joining us here on Health Professional Radio. It's been a pleasure speaking with you.
Thank you.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. MeiLan Han. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download it SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com Health Professional Radio.